the opportunity to individualize care, both medical care as well as surgical care, I think is a real possibility in the future. Right now we know, for example, that certain patients do better with certain kinds of medications, antibiotics, anesthetics, and as we understand more and more about the individual needs of the patient, I think you'll see that surgery itself will become more and more individualized as well. I think if a surgical resident were to come to our program, they would be very comfortable here with the latest technologies as far as imaging is concerned, the latest technology as far as diagnostics are concerned, the latest technology in the operating room with robotics and minimally invasive surgical instruments and so forth. But more than that, I think the opportunity to help develop new technologies because of our relationship with the School of Engineering, with the number of engineers being on our faculty, we being on their faculty as adjuncts, I think really does give the surgical resident in training here an opportunity to be at the cutting edge of surgical technology. The research in the department is, I would say, centered around probably three primary foci. One is in the area of surgical education. Because we have the Dr. Alexander J. Walt Chair of Surgical Education, we have made it a real learning opportunity both for the residents, but also a research opportunity for both the residents and the faculty in the area of surgical education. How is it that surgeons learn their craft? What are the techniques which can make that learning more effective? What can make it quicker, and so forth? So surgical education is one of the main foci for research. Another foci for research is in the area of cancer drug development. We have a strong cancer drug development program in Carmanos and the Veterans Administration Hospital. The third would be probably in the area of trauma and shock and trauma. This area has been a long-standing interest in the Department of Surgery, particularly because of the distinction and the experience that our residents and our faculty have in trauma. The Detroit Receiving Hospital has a very rich and glorious history in the management of critically injured patients. One other area is the area of surgical technology and the relationship with the SSIM, with the School of Engineering. This collaboration, which we have been part of for more than probably 8 or 9 years, really draws on the unique aspects of a relationship with the engineering school. This relationship allows the surgical team to have a place where they and a group of people to whom they can talk about ideas in surgery and development of surgical technology. These four areas, the area of surgical technology and the relationship with the School of Engineering, the area of drug development in the cancer field, the area of shock and trauma, and the area of surgical education. I think these are the most important areas of research and investigation, and I think are the things which the department is best known for. Often when students come for interviews, they ask the question, what is it that the department is looking for in the surgical resident? And what I tell them is, first and foremost, we're looking for people who have a passion for surgery. That may sound like a bit of a corny answer, but in fact, we're looking for people who really want to be surgeons. We do get from time to time, not too often, but from time to time, people who have the idea that it would be nice to be a surgeon, but don't have the passion for it, don't have the interest in putting in the effort to be the kind of person that they need to be a quality surgeon. What I would say to the inquiring student who is deciding whether or not they should come to the surgical residency is that if you come and if you put the effort in that is required, you will leave here an excellent clinical surgeon. And if you want to be more than that, if you want to be have a research career, if you want to have an academic career, you will have that opportunity as well. This is a program where you will get out of it about what you put into it, which I suppose is not particularly unusual. But more than many programs, this is a program which allows a resident to kind of grow and to expand to the ability that they want to be. And to me, that is really all a medical student or a prospective surgeon can ask for. I can promise you that if you come and you do that, you will leave here an excellent clinical surgeon and will have not a day of regret.